Hi, I'm Thompson McMurtrie, and I'm an orthopedic surgeon specializing in sports medicine and arthroscopy and joint replacement, particularly of the shoulder, elbow, hip, and knee. And I work at TOC, the Orthopedic Center. I primarily see patients in Huntsville, Madison, and Ardmore. So I think it's helpful to talk about the anatomy of the hip. The hip is a ball and a socket joint, and along the rim of the socket is the labrum. And the labrum is a ring of cartilage, and it's one of its main purposes is to allow a suction seal for the hip. And it is an area that can tear, and when it tears, it can be painful and symptomatic. Symptoms of a hip labral tear are primarily pain and pain with activities or pain shortly after activities. It can also be related to certain positions, such as the seated position or deep squats. And often people will feel the pain deep in the groin or the front part of the hip. It can also cause catching or popping sensations as well. And this is due to the fact that the labrum, as it tears, can create almost a flap that can move in and out of the hip. While labral tears of the hip certainly can be caused by an acute event or an injury, they're generally thought to be more caused by the way that someone's hip is formed. And I'll explain. As I mentioned earlier, the hip joint is a ball and a socket, and the labrum resides on that rim. And so some people, due to genetics or a way that the growth plates developed as a child, have a certain development of the hip that predisposes them to a labrum tear. So whereas the ball is supposed to be nice and spherical, some people have a flattening or even a prominence right here that when they get in certain positions like flexing the hip or sitting or even repetitive squatting and things like that, as the hip flexes up, it pinches on the rim of the socket, which is where the labrum resides. Other people can actually have a socket that is a little bit overly developed, or there's a bit of an overhang there. And again, these anomalies or just these variations in the way people are developed can sometimes lead to a labrum tear just from the repetitive nature of being active and playing sports and running and doing the things that we love to do. But over time, as this causes the tear, then for some reason they become symptomatic. That's why a lot of people will have sort of a story that they didn't have a particular injury, but over time they've noticed this sort of deep groin pain. And the medical term for this is impingement, particularly femoroacetabular impingement, FAI, if you want to read about it online. Typically, treatment for a hip labrum tear begins with conservative treatment, and that consists of physical therapy, anti-inflammatory medication, as well as activity modification. If this fails or doesn't work, then the next line is often a corticosteroid injection, and sometimes we'll also use a numbing medicine at that same time. And this can provide relief. And again, the purpose of these conservative options is really to just calm the inflammation and the pain down from this aggravated tear. So if conservative treatment fails, then there's certainly a role for surgery. Surgery is arthroscopic, meaning we use a camera and several small incisions, and we go in and we repair the labrum and also remove the excess bone that is causing the hip impingement. It's an outpatient surgery, meaning you go home the same day, and typically we keep you off of it or allow you to put only about 20 pounds of your body weight on it for several weeks. And after that, we typically will do some therapy, and the typical course of full recovery is about 3 to 4 months before it really lets you return to full activities. If you think you may have a labral tear, please give us a call. I'd be happy to see you and care for you.